Thanks for inviting us in. All eyes are on Indy's proposed budget for the coming year, and we know crime has been this big focus, not just for city leaders, but everybody who lives here or visits. But the other part of that is investments in our criminal justice system. And tonight, that was front and center at the City-County Council meeting. Our Rachel Krause joins us live from the newsroom tonight. She's been breaking down the issues that criminal justice leaders say they're now facing. Rachel?
Yeah, Scott, coming before the City-County Council, the Marion County Prosecutor's Office, Public Defender's Office, and Community Corrections voicing concerns for programs in need of funding to help crack down on crime around Indianapolis. Marion County Prosecutor Ryan Mears says theft and domestic battery are the most common charges being filed right now. He tells us Indiana's new law no longer requiring a gun permit eliminates one way police solve crimes, where they were able to test weapons taken from felons and test them against ballistics from previous crimes. Mears says a big focus for his office, cutting down on youth-involved crimes.
One of the biggest trends that we're seeing right now as it relates to violent crime is young people and firearms.
Mears says there are hundreds of dangerous possession cases filed for juveniles. He says it comes down to easy access. Most often, guns bought and sold online. Now they're refocusing on reaching kids in Indy at an earlier age to cut down on that trend. But a big problem facing both the prosecutor's office and the public defender's office is too many cases and not enough pay. Right now, those problems are leading to good employees walking away. Bob Hill, chief public defender in Marion County, says his office is down 11 social workers because they can't pay enough.
They would like to stay. I mean, I can't tell you how many people have left, but so it's a real issue for our staff and the morale of our office. It's a real issue for our community. Make certain we have adequate staffing to get the job done.
He's asking for $10,000 in raises for all social workers and $7,000 for all attorneys, just to stay competitive with other agencies and keep quality staffers. Hill says both they and the prosecutors are calling on the City-County Council to make these needed investments in wages, and he says it's important that both agencies get this funding at the same time to ensure that both sides of the justice system have fair and equitable options. Felicia?
Thanks, Rachel. And we know anti-crime investments are crucial to keep people out of the criminal justice system. The mayor's proposing a $150 million investment over the next 3 years, investing in the community, police, and addressing the root causes of violence. The community investment includes $15 million each year for violence reduction grants. They're also looking to establish an emergency response team made entirely of mental health experts who are on the clock 24 hours a day. Now, this would be in addition to the city's existing mobile crisis assistance team. But it's an investment that Indy Black Lives Matter says doesn't go far enough. They'd like to see more money toward mental health assistance and less for police funding. You can find a full breakdown of the current budget proposal on WTHR.com.
Now, all of this comes as IMPD investigates another violent night. Just an hour ago, police alerted us to this deadly shooting near High School Road and Rockville Road on the west side of Indianapolis. Our crew at the scene tonight is working right now trying to get details on the man who died and potential suspects. Angela?
Scott, for most of us, clear skies and temperatures already in the 60s, including 65 in Bloomington, 66 Columbus, Muncie 65, 67 Greencastle, and 63 right now in Terre Haute. Upper 50s to around 60 early tomorrow morning. If you're headed to the Indiana State Fair, another sunny day at the fair.
New tonight, Indianapolis EMS is highlighting changes it's made to make sure that Hoosiers get the life-saving care they need. Over the last few years, we've seen ambulance calls increase by about 44%. Meantime, there's been a decline in the number of EMTs and paramedics and an 11% drop in available ambulances. So how are Indy's EMS teams coping? The chief of operations outlined how they've adapted in this article for the Journal of Emergency Medical Services. We read it through so you don't have to. So tonight, I want to go ahead and break down the basics for you. So the first thing to know, there are now two types of runs EMS responds to. Advanced life support requires a paramedic, which right now are in short supply. Basic life support is where your EMTs come in, no paramedic needed. But a review of past transports revealed paramedics spent more than half of their time responding to basic support runs, leaving them unavailable for advanced calls. So they switched things around. So now paramedics only go on calls requiring advanced care. That way they're available when needed. Now, when it comes to EMT staffing, the department created a trainee program a couple of years ago that requires no experience. You go through a 10-week course and get hired on full-time after you're done.
This isn't just something we're doing quickly to resolve a work shortage. We want to commit to this kind of recruitment, this kind of training, and bringing people into the medical field.
The next challenge is getting more ambulances. And while IEMS says that's still a hurdle, it's a lot easier to address than finding paramedics amid this nationwide shortage. If you'd like to read the article outlining these changes, we've got a link posted for you right now on WTHR.com.